know that in British Columbia, for example, they've had to cancel some of their scheduled surgeries because they've got about 3,300 workers that are out on leave now and are being requested to have vaccinations. And Quebec has just announced that they are taking another look at their original mandatory vaccination policy. So we took a look at that and the concern that we had that we would lose some of our precious health human resources compared to a relatively small number of outbreaks.
The vast majority of physicians have stepped forward and gotten vaccinated. It's in the high 90% level now through surveys through the College of Physicians and Surgeons of Ontario. So many healthcare workers are embracing protection of themselves, their family, but also of their patients. I think for healthcare workers, if you haven't been vaccinated, please, I think it's your professional duty to do so.
The Ford government will not mandate COVID-19 vaccines for healthcare workers. In a statement, the Premier saying today he's not prepared to jeopardize the care of millions of Ontarians, citing concerns this could lead to tens of thousands of healthcare workers being terminated.
It's important to note, though, the Premier wrote to a range of medical experts and stakeholders last month asking for advice. Today, the health minister saying this is the right decision. Is it the right decision, though? Joining us tonight to offer their perspective is Doris Grinspun, CEO of the Registered Nurses Association of Ontario, and Dr. Michael Warner, Director of Critical Care at Michael Garron Hospital. Good evening to both of you. Dr. Warner, we'll begin with you. I know you're not a fan of this decision. In fact, you've taken to social media, to Twitter, to say this is a bad decision. Can I ask what's running through your mind tonight?
Yeah, this is a bad decision. This is the wrong decision. Healthcare workers should be vaccinated. End of story. When you're in the public service caring for the most vulnerable people, it's your duty to be vaccinated. And fortunately, hospitals tend to have strong leaders in most hospitals, including just about every hospital in Toronto, including the UHN, which cares for the sickest patients in the country, has mandated vaccinations for their healthcare workers. It's the right thing to do. It makes sense. And the government, the Premier, needs to stand behind hospitals, not pass this decision on to them. Because we're creating a situation where there could be institutions that don't have as strong leaders, who don't have vaccine mandates, where unvaccinated healthcare workers could congregate and have a concentrated high-risk situation for patients.
Right, Dr. Warner. Sorry, go ahead.
I was just going to say it's also extremely ironic on the day that the government creates, a really good plan for the third shot, identifying that healthcare workers are at risk of passing on COVID to their patients as waning immunity could occur. They also won't mandate the first shot for healthcare workers. It doesn't make any sense.
Okay, so are you able to sort of paint a picture for us tonight, perhaps take us into the ICU department, a healthcare worker deciding not to get vaccinated? What does that mean for patient care, Dr. Warner?
Well, I think the truth is, Lena, that most hospitals, because this is such a softball issue, have vaccine mandates, just like long-term care homes will have them on November 15th, because it makes sense. So the impact, I'm not sure what it will be. It definitely won't be tens of thousands of people, out of work because, Christine Elliott, the minister, won't actually stand behind that statement the Premier made earlier today. I think there'll be some people who choose not to get vaccinated, but let's be clear. Do we want people who are unvaccinated caring for our most vulnerable? I don't.
Doris, the Registered Nurses Association was amongst the first to call for this policy to be put in place. It's in place still at long-term care homes. We're seeing the effectiveness of this policy in those kinds of settings. What's going through your mind tonight? And do you think that this could have led to thousands of nurses, for example, having to be terminated?
That's absolutely not the case. And the Premier knows it's not the case. So the Premier is choosing to confuse the public and is choosing to hide the real reason why healthcare workers are leaving, which is Bill 124. And I invite the Premier, as well as all the other political leaders, to our November 14 rally at Nathan Phillips Square, so we can explain to him once again. As you know, I speak with him often. As Dr. Warner said, even the minister didn't stand by the Premier's statement of tens of thousands of people will leave. That is fantasy land, and that is the Premier way of catering, quite frankly, to the few anti-vaxxers within any of the professions. I said today in Global News, and I will say it again, if I were a patient in an ambulance, I will choose a hospital where everybody has a mandate for fully vaccinated. And if they tell me that I'm creating mistrust on the health system, call the premier. Call the premier, because not only is letting down the CEOs that stood up for it, RNAO, which said all nurses need to be vaccinated, in fact, is letting down his own Minister of Long-Term Care, Rod Phillip, who did the right thing for long-term care, and we stand by Rod Phillip. And I think he put the Minister of Health, either because she decided not to run again for elections, quite frankly, I don't know, or because she needs to put the face for the premier. The premier needs to master the courage to come in public and explain his rationale.
Doris, so if
It's
this is
very upsetting. It's very upsetting.
If I could interject, if this is fantasy land that tens of thousands of healthcare workers would have lost their jobs, paint a picture as to what that number would be like. Would it be hundreds of nurses walking off the job?
It would be in large institutions. It will be 120 not nurses amongst all the health professions, whether it's cleaners, nurses, a few doctors, artists, whoever they are. And in the smaller organizations, much less. The bottom line is that the great majority of hospitals said to the premier, move with that. 20 of the home care agencies said to the premier, move with that. RNAO said to the premier, move with that. And for Minister Elliott to say she cannot put those letters public, well, I'm sure that the hospitals that said yes, they want the letters public. And for the few that would have had trouble, the same as RNAO helped with Via Nurse, when we had issues during the pandemic and we moved people to 350 nursing homes.
Right.
We could have moved to the 20 hospitals that had trouble.
Okay, Dr. Warner, I want to give you a chance to weigh in here because I want to pick up on what Doris was saying. We heard from the Ontario Hospital Association today releasing a statement saying there is a strong consensus among Ontario's hospitals for a provincial policy requiring healthcare workers to be fully vaccinated. You know, the Premier reached out to these healthcare experts. He asked for this advice, yet he hasn't really listened to that advice. What do you say to that? Does it feel like he's not listening?
Of course he isn't listening. I mean, this is not a public health decision he's made. It can't be. It's not based on science. It's not based on evidence. It's not based on what people who know what they're doing think. It must be based on something else because it doesn't make any sense, and he should change his mind because this is the wrong decision. I mean, what's been lost here, and Dr. Grinspun alluded to it, is the patient's perspective. I mean, if you're a patient, we all could be patients one day, including those people who've chosen not to get vaccinated. Would you choose to be cared for by someone who doesn't believe they should be vaccinated to protect you? Or would you choose to be cared for by someone who is vaccinated, just like they wash their hands, they wear a mask, and they get a TB skin test every year to protect you as their patient? I know what my decision would be, and I think most people would want to be cared for by someone who's vaccinated. And as the leader of the province, it's his responsibility to set the tone, not just within healthcare, but within the entire scope of what we're doing here, that vaccines are important, and they are a way towards more freedom and more normalcy. And a healthier population.
And I want to hear from you on this, the Ford government saying that if they were to implement a mandatory vaccine policy for healthcare workers, there would be significant job losses. Do you believe that?
Absolutely not. Let's just think about that. If you create a blanket policy that covers home care, long-term care, hospitals, doctors' offices, physiotherapy clinics, et cetera, how many people in this province can afford not to work?
Exactly.
Not many people can afford not to work, but if you create carve-outs where people can work and they're not vaccinated, well, then you've created a system where people can game it. You make the policy blanket and it takes care of itself.
Dr. Warner, to your point about not taking the patient into consideration, are you seeing patients in your ICU saying, Dr. Warner or Dr. So-and-so, are you vaccinated? Are they asking these questions?
I think patients should be able to ask that, but, medicine is a hierarchical system where we talk about putting the patient first, but it isn't always the case. Patients should be empowered to ask me whether I've washed my hands, whether I'm vaccinated, and I think that culture will change. But I think for this, they should just assume that I'm doing everything possible to protect them because that's my job.
Doris, I heard you trying to weigh in. Go ahead.
They are asking nurses. Absolutely, they're asking nurses. My colleagues are tweeting about that. But what the Premier has created is what happened in the U.S. In the U.S., those people that were not vaccinated moved to places where that is not a mandate. So the patients, the people of Ontario, going to places that are actually don't have a policy on mandatory vaccination will get a higher number of health professionals that are unvaccinated. And my biggest fear is home care, because in home care you have very vulnerable people. If someone is getting chemotherapy at home, it's because they're vulnerable. If someone is getting even from a PSW, a bath at home, it's because they cannot do it alone. And we will be sending there more and more people that will be leaving the UHN, will be leaving the North York General, et cetera, to go and work in places where it's not mandatory. So watch it. We are creating chaos.
I want to give both of you perhaps 30 seconds to answer this next question, and then we got to run. But why do you think the Premier isn't listening to the medical advice? Why do you think he isn't implementing this mandatory vaccine mandate? Dr. Warner?
I have no idea what goes through the Premier's mind. I just know that if you follow science, as we have so far by implementing, vaccination certificates and mandates in a lot of different circumstances, we can actually be a leader in this, as Ontario has been. We've done really well in wave 3 of the pandemic. Let's keep it going and make sure vaccines are mandatory in healthcare settings because it makes sense.
So I will be less elegant than Dr. Warner. And I will say that the Premier today made a political decision to his base. I would say that as a person that actually through the pandemic became closer and closer to the Premier, I'm hugely disappointed because for once, I thought the Premier is governing for everybody, but today he made clear for whom he is governing, and we better watch it. Premier, I have sent you text. We have spoken in the phone. Wrong decision today. Reverse and fast.
Okay. Hopefully the message is received if the Premier is listening. Doris Grinspun, Dr. Michael Warner, thank you both for your time and for your perspective tonight. We certainly appreciate it.
Thank you.
Thank you.